All right, hello, welcome everyone to Phoenixville Library, those on Zoom and in our room here, to our presentation tonight on low back pain. We're pleased to have back with us Dr. Jeff Kurtz of Kinetic Physical Therapy. And those on Zoom, feel free to type any questions in the chat at any time, or you can unmute yourself at any time during the presentation too, and those in the room can unmute themselves anytime as well to ask their questions. So without further ado, Dr. Jeff, take it away.
Thank you, Mark. As Mark said, my name is Dr. Jeff Kurtz. I'm the clinic director of our Phoenixville YMCA location and our Collegeville location, which is up at the Providence Town Center, the Wegmans. So I've been practicing since 2019 when I graduated from Temple with my doctorate in physical therapy. Been with Kinetic the whole time, so now I practice both out of the Collegeville and Phoenixville location. So like Mark said, if you guys or the Zoomers have any questions, just feel free to raise your hand and let me know, because I want to make sure I get your questions answered in a timely fashion. So today I'm going to be presenting about the truth about low back pain. This is a presentation we've been doing for a lot of years now. It's very relevant. It's the number one reason we see people in our clinic is low back pain, right? It's about a third of all of our cases right now. The next being neck pain and then shoulder pain, knee pain, in that order. So it's very relevant. It's why we've been bringing it to the community for a long time. And again, if you have any questions, I want to answer very specific questions if you're interested. So first I want to start off with some trivia. So what's the number one predictor of whether you will have low back surgery in the U.S.? And by the way, the U.S. has 40% more back surgeries than any other country, so we're winning, right? Right. So is it an MRI or of a herniated disc? Is it pain severity and location?
Lack of exercise.
Is it loss? I wish that was up here. Is it loss of strength and reflexes? Or is it zip code? It's zip code, okay? So the number one predictor of whether you'll have low back pain, or low back surgery, I'm sorry, in the US is your zip code. So really it's proximity to the hospital or healthcare. So close proximity means that you are at a higher risk of having low back surgery.
What?
Wow.
Yeah, right?
Is that just ka-ching, ka-ching? I'm sorry.
Yes, it is. So we're going to start off with the spinal fusion. Anybody know anybody that's had a spinal fusion? Right? So that's where they've taken one piece of your spine, fuse it to the next one, and usually it's because people are having some sort of radicular symptoms. Radicular meaning symptoms down the leg, right? Numbness, tingling, shooting pain, loss of strength. So spinal fusion was something that was recommended for a very long time to address these issues. So much so that the surgery rates have increased 600% since 1992. Okay? This is the aggregate cost to the U.S. healthcare system because of a spinal fusion. So we started off at about 600 and, I'm sorry, these are just fusions in general. So 969 in 1992, and it jumped to almost 16,000 back in 2012. So I have to imagine that number continues to rise. The cost per surgery has tripled. So, you know, hospitals, doctors are getting reimbursed more for these surgeries, and you know, at that time, $40 billion were spent on fusions each year. Right. So it's a number that we're seeing increase year after year. It's in some circles considered the lobotomy of our time. Really because of that number right there, the 34% success rate. Okay. Anybody ever heard of Tiger Woods?
Yeah.
Right. He had 6 successful spinal surgeries. Right. 6. How can you consider a spinal surgery successful if you had 6 of them? Right. So it's a 34% success rate, meaning that another surgery was not required after that. Okay. So 1 out of 4 had a repeat surgery, 1 out of 3 had a major complication, and 1 out of 3 had a chance of never returning to work again, following a lumbar fusion.
What major complications? I mean,
Vascular issues, loss of motor control, loss of sensation, things like that. Okay. I have to assume that death was included, but I'm not sure if that actually occurred or not. And then in 2009, there was a conference for surgeons, right? And they did a study where they took 100 of them and were asked if they'd elect to have a lumbar fusion if it were recommended to them. And 99 out of those 100 would said absolutely not, but they're doing them, right? And this is kind of what you touched on earlier was why. So low back pain occurs in 80% of the U.S. population in a lifetime. So it's something that's very, very common. A lot of people are experiencing them. To what degree is a really big distinction. Some people have low back pain that lasts a week and they never have it again. Other people struggle with it for years and years and years and never really get back to what they were before their incidence of low back pain. So it's $87 billion of healthcare dollars are spent on low back pain each year, and that number grows. And that accounts for 25% of all healthcare expenses. So you consider all the big ones, cancer, heart disease, diabetes. Low back pain accounts for 25% of costs. So where's all this coming from? We'll discuss that in a little bit. But and you see at the bottom here, the healthcare expenses for someone with low back pain will be 60% higher than someone without low back pain. There's a few different reasons for that. Prevalence of low back pain is a little bit higher in people that are generally sedentary, maybe have higher comorbidities, so things like heart disease, diabetes. Somebody might be at a higher risk for having low back pain if they have those sorts of things, but it plays into the healthcare costs very highly. Right? Where did we go wrong? So there's a very nice quote by Dr. Mary O'Keefe. People with low back pain are often told to do the exact opposite of what the science says. So, you would hope that when you go see a healthcare professional that they are looking out for your best interest by following what the science and what the data says we should be doing. But, we live in a capitalist society where, healthcare is not, just cut and dry. Right, there's a lot of business that goes into it. So, you might have seen some of these things: injections, ultrasound. This is cupping down here. Again, this is the lumbar fusion surgery. So, this is not necessarily what research is saying that we should do, but a lot of us are recommended to get these things when we go see somebody for low back pain. All right, so this is a typical episode of low back pain in the U.S. So somebody starts to feel low back pain, they let it go maybe a couple days to see if it'll get better. And if it doesn't, they'll go schedule an appointment with their primary care physician. All right, a lot of times the primary care physician will recommend some kind of medication, muscle relaxers, steroids in very specific cases, extra strength Tylenol, something, right? And remember, every time you see a line, that indicates money is being spent, right? You go see your doctor, your insurance gets billed, you pay your copay, you get medication, that costs your insurance. Then you go back to see your doctor, hopefully that medication helped you feel better, right? If it didn't, then you move on to the next phase. Maybe you get an x-ray to make sure that there's nothing crazy going on. You don't have a fracture. Maybe you have some arthritis in your lower back. That gets read. Nothing crazy shows up on that x-ray because unless you fell or you fractured something, an x-ray of a low back is really not going to tell you a whole lot. So then you go and get an MRI, right? X-rays are fairly cheap when it comes to healthcare spending, which is why your doctor is always going to recommend that x-ray first, because they're trying to save the healthcare system money. But you go and get an MRI, and MRIs are very expensive, right? That MRI is going to reveal a lot of things, okay? Essentially, everybody over the age of 40 or 50 is going to have a very imperfect MRI result of their low back. I don't think I've ever seen a perfect MRI report in any case, okay? A lot of times you'll get recommended an injection in your lower back or multiple injections in your lower back. All right. In some cases, you'll be recommended physical therapy. You start exercising between the combination of medication, perhaps an injection, exercising. Hopefully you get onto the path of being pain-free. But you saw how many steps it takes you to actually get to a place of where you're getting active results, right? Not just medication or imaging or injections, right? So we touched on medication, right? You know, we all dealt with the opioid medication. A lot of us are still dealing with it, right? The jump between 2003 and 2014 was astronomical, okay? Low back pain was the #1 reason for opioid prescriptions, okay? A lot of that was opioid companies and pharmaceutical companies pushing that onto your physicians to try to you know, increase sales of medications. But really, when we talk about the opioid epidemic, this is why a lot of the opioids are out there, is for treatment of low back pain, right? The U.S. makes up 5% of the world population, but we consume about 80% of the global opioids and 99% of all hydrocodone, right? Why?
It makes money for the pharmaceutical
Thank you.
industries.
Thank you. Okay. So, do we really need that expensive X-ray and MRI? Again, we discussed about how, you know, an X-ray is not going to show a whole lot unless you fractured something, right? An MRI has, you know, research has never shown a link between degeneration on an MRI or X-ray and actual low back pain or neck pain. So, there's been a lot of studies
So
that have
MRI
been,
does not show that
Correct.
degeneration?
it does, but symptomatic
Okay.
degeneration, okay? So in a 2015 study of a lot of cervical spines, asymptomatic subjects, okay, that's the important part, asymptomatic, no symptoms. 88% of people without neck or arm pain have a disc bulge on an MRI, okay? So there's people walking around with absolutely no neck pain or low back pain whatsoever, but we take those same people and give them a free MRI, and there's a very, very good chance that they're gonna have some kind of disc bulge on an MRI. So then you take somebody that experiences an acute bout of low back pain or neck pain. You gave that same person that free MRI, there's a good chance they're gonna have that disc bulge. Your doctor's gonna take a look at that MRI and say, "Ma'am, sir, you have a disc bulge," okay? But we're not really sure if that disc bulge is the reason that that person is currently having low back pain, because there's a really good chance that they had a disc bulge before they even experienced low back or neck pain, right? That's the difficult part about an MRI, is it doesn't tell the whole picture. Everybody thinks that you get that MRI, you're gonna know exactly what's going on in your body. Unfortunately, it's just a snapshot in time. It doesn't tell you anybody, you know, what happened 3 months ago when you actually experienced the pain, or what's currently going on in your body, because we all know that the human body is very complex. There's a lot of things that go into why we're currently feeling what we're feeling, right? People experience headaches, people experience nausea, and a lot of times it does not have a lot to do with what's anatomically going on, and more so, you know, more of a psychosomatic level, right? Poor quality sleep, all of those things increase pain and affect how we're feeling, okay? These are some more results in people without low back pain, okay? By the age of 50, there is an 80% chance that you're gonna have disc degeneration, which is a term that we very often hear. It's basically, you know, arthritis, you know, thinning of the actual discs in your vertebrae. So there's a very high chance that somebody over the age of 50 is going to have one of the disc degeneration or disc bulge or disc height loss, that when you go and get your MRI, a lot of times your MRI report is going to say these things to you, that you have these issues. There's a good chance if you didn't start to develop low back pain until you're 70 that you had some of this stuff going on when you were 50.
What is facet degeneration? The top?
So facet degeneration is basically the joint
Okay.
space between you know, the outside of the spine. So if this is the spine, the facet is on the
Oh,
outside.
I just wasn't, I had
Yeah.
never heard that term.
Yeah, it's a good question. It's a good question. Right. There's a lot of you know, people that come in and tell me that, you know, my doctor 20 years ago told me not to bend and lift, right? They told me to lift with my legs all the time. And that's fine if you're gonna lift really heavy, bulky objects that you're gonna struggle with, right? But generally, your low back is very strong. It's a very complex joint. There's a lot of muscles that go into effect when you just bend to pick something up. To the point that if it's a movement that you're regularly practicing, it is very healthy for your low back to actually be doing that. You know, a lot of people blame, hey, I went to pick something up, I hurt my back, I shouldn't have bent like that. In reality, you probably should have been bending like that for 10 years and kind of training your body to do that, okay? I can't run a marathon, okay? I can't go out tomorrow and run a marathon. But if I want to run a marathon, I'm gonna start off with a mile. So if you want to be able to lift heavy objects, if you want to be able to bend your low back, you don't start by lifting heavy objects, but you start by picking up something small by utilizing your lower back, okay? So if that's a movement that you regularly do, you should be able to pick things up with your lower back, okay? The spine is actually a more stable structure when it is curved, okay, as opposed to when you're standing up nice and tall, because you're getting more muscles engaging when you start to lean forward, okay? The issue that we run into a lot is that we see people that, you know, don't bend their back, they just stand and keep it very rigid, okay? And those muscles are not getting worked as much, okay? So what's the solution, okay? We spend so much time talking about the prevalence of low back pain, how often do we have it? What's really the right solution according to what the research says, right? The first thing is reassurance. The big reason we do that is because there's a lot of fear that goes into low back pain, right? What's important to remember is that the low back is a joint just like your hip is a joint, just like your knee is a joint, right? So when somebody experiences low back pain, the first thing that they do is they stop moving, they stop exercising, they stop bending. What we do is that when you come in for your initial evaluation, we encourage you to use your back, because the worst thing you can do is not use it at all, right? We encourage people to stay active and exercise. Actually, the first thing that we do when somebody comes in with neck pain, mind you, neck pain, is recommend walking, okay? How does walking treat neck pain? What we're trying to do is we're trying to promote blood flow, right? Tissue healing is blood flow, right? Blood flow is what brings nutrients. It's what helps get toxins out of your body. And in order to do that, you have to get your heart rate up in some way. If you really want to target a certain part of your body to try to promote blood flow, that's why we stretch and that's why we exercise. So somebody's back who hurts them because they haven't moved, they sat in a plane for 3 hours. Stretching feels good. And the reason it feels good is because you're promoting blood flow, right? That's why when you sit for too long, your whole body gets achy, your joints hurt. The first thing you gotta do is you gotta start moving those joints and getting some blood flow there, right? So that's stretching and that's strengthening, right? Trying to keep your day-to-day activities normal, even if you are experiencing some kind of acute low back pain, is very important. You know, we see that people that regularly miss work because of low back pain have a very low rate of actually returning to work in the long term. It's very important to maintain your day-to-day activities. Even if it's a modified version of that, right? If your symptoms are very flared up one day, but on Tuesdays you vacuum the entire house, maybe on Tuesday you vacuum the first floor. That would be the recommendation, is don't completely lay in bed, because that's really the worst thing you can do. And then early access to physical therapy is associated with better outcomes and lower overall healthcare costs. So skipping the doctor, skipping the x-ray, skipping the medication is very important. You can get access to physical therapy very soon, and it's going to overall reduce the cost of healthcare, right? That's because people generally get better when they just start moving, and that's the first thing that we're going to do, right? Not many people know this, but in Pennsylvania, you can get access to physical therapy for 30 days before you require a physician's prescription. Okay, that's called direct access. So you can see a physical therapist for 30 days without a script. All right, a little bit more in terms of the cost of low back pain. So the cost is about $2,800 less when PT was initiated within 14 days of an actual injury, right? but only 7% of people are actually referred to PT within the 90 days. And that's really because it takes time to see your primary care physician. They ask you to try medication for 2 weeks, then you get your x-ray, and so on, right? The difficult part about that is that the more chronic an issue is, the much harder it is to treat. Usually it's because people change the way they move. Okay, so if somebody starts experiencing low back pain, they stop bending, they stop moving around as much, they may change the way that they're walking. And then the longer inflammation is a chronic issue, the harder it is for symptoms to actually calm down a little bit. So it makes my job a lot easier when people come immediately rather than waiting 90 days, because really 90 days is more considered a chronic problem at that point. All right, so we're going to transition into a really complicated, complex concept of chronic low back pain. And this really takes into account psychology in our brains, okay? So does anybody have any questions yet so far? Anybody from Zoom?
Nothing yet.
Perfect. All right, so when we talk about chronic pain, essentially what chronic pain is, I know this is very pixelated, but what's going on here is this is injury and tissue damage, right? Healing, okay? So in the beginning, let's say that this is when injury happens, okay? Let's say you strain your low back because you tried to lift your bike and twist and put it into your car, which happens a lot. Tissue damage is real, it happens, right? You're gonna have inflammation here when that goes up, okay? Inflammation is tissue healing, that's good. You want inflammation, okay? You get knee surgery, your knee blows up, you want that, okay? What you want is that inflammation to eventually go away, right? And in most cases, that's what happens, right? Inflammation goes away, tissue healing happens after a few weeks, and then you go on your way. However, this is what happens when chronic pain happens. So somebody gets stuck in that cycle of constant inflammation, right? And then your nervous system is constantly on edge. You're constantly feeling that pain, and then it's hard to get out of that cycle. Okay, and that's where chronic pain happens, is you basically get caught in that whole inflammatory process. And then this becomes more of a month and yearly issue as opposed to weekly. Right? So again, this is very complex. There's no simple solution for a complex problem. Right? There's a lot of things that goes into chronic pain. Somebody gets stuck in that pain cycle, and then they start to talk with family, and people start to throw things onto that fire, right? I always talk about an injury as if it's a fire. What we're trying to do is we're trying to pour water on that fire, and a lot of times people are throwing gasoline on the fire. You know, you have family members that tell you horror stories of low back pain. You know, your Aunt Sally had a really debilitating low back pain. Maybe it's just in your genes, which our healthcare system puts way too much emphasis on genetic issues as opposed to environmental and what we're doing with our bodies, right? I think I touched a little bit on psychosocial factors, so stress, poor quality sleep. How many people can sleep well with low back pain? Right, not many people. However, there's a lot of research to show that pain sensation is increased when you have poor quality sleep. It's increased when you have high stress, which when I'm in pain, I'm pretty stressed, right? We have a lot of things going on in our day-to-day activities if you work a stressful job. All of these things constantly start to play into your pain. So then all of a sudden your pain feels worse because you're not sleeping well, and then you're not sleeping well because your pain feels worse, and all of a sudden you're just not sleeping well. And that's how these things occur. So just understanding that what you're going through when you have chronic pain is multifaceted, and there's a lot of things that go into fixing those things. It's an important concept to understand and a difficult conversation to have. Right? Another big take-home message would be more pain does not equal more tissue damage. Right? Anyone ever get a hangnail or a paper cut? Right? That stuff hurts, man. I mean, that really hurts. But tissue damage on a hangnail or a paper cut is not that severe. Right? But why do we feel so much pain? Again, it's because your body basically is just trying to protect you all day, right? That's what your nervous system is doing. right? You put your hand on a hot stove, your brain is trying to protect you from tissue damage, okay? So if you start to experience low back pain for a long time, your brain is going to learn really quickly, hey Donna, I really don't like when you bend over forward, so I'm going to start sending those pain signals at you because I don't want you to do that anymore, right? Now all of a sudden when you do something that shouldn't be causing tissue damage, it starts sending pain signals at you, you're going to stop doing that thing. And then when you stop doing that thing for a long time, your brain is going to retrain itself and say, I just don't like bending. Right? Maybe before tissue damage was at this point, but now all of a sudden your brain's already telling you right here you have low back pain because it doesn't want you to go any further. Right? That's why you feel a stretch sensation. Right? Your body is telling you when you're stretching your hamstring, hey man, don't go any further, that's going to hurt. You could cause tissue damage. That pain intensity and that nervous system gets even smarter the longer it goes on. It's going to tell you sooner and sooner and sooner that, hey, you're running out of room. When in reality, you could actually go further. It's just your nervous system is way too smart. All right, I like to tell this story about a young construction worker. Right, he skipped the last couple parts of his ladder, the last couple levels of his ladder, and jumped down, and nail went right through his shoe. Right. Went to the hospital. They couldn't take the shoe off. He was in way too much pain. Had to sedate the guy. Then they take his shoe off, and the nail went between his toes. Right? But he felt real pain. Everything that man was feeling at that time was, oh my God, there's a nail in my foot. He'd start sending pain signals, okay, telling him, you're in deep doo-doo, you got to get out of this right now. When in fact there was absolutely no tissue damage, right? Your brain is going to tell you what it sees. There's another story about somebody another construction worker, don't do construction, had a nail gun, heard it go off, had no idea where it went, started developing a toothache, and then like 3 weeks later he goes to his dentist, they take an x-ray, there's a nail going up through his septum, but he didn't see it, he didn't feel it, because what you perceive is what your nervous system is going to tell you, right? And that's the problem with an MRI a lot of times, is that you get a very imperfect MRI result, and now all of a sudden your brain thinks, well, I've got a disc bulge, and I've got facet issues and degeneration, I have arthritis. Your brain's going to start telling you that your low back is fragile, that you shouldn't move as much, that you shouldn't bend as much, and that's going to increase how much your brain is going to affect the pain that you feel. Okay, that's why we harp on MRI results not always being the best thing for our patients. So what we do in chronic pain is we do something called cognitive functional therapy. Right, cognitive functional therapy is basically very gradually exposing the body to new positions and new activities, right? It's a very important concept because we have to get that person in a therapeutic state. So somebody that constantly thinks that they're going to hurt their low back when they bend, we're going to introduce them to very, very small gradual movements, basically to down-regulate the nervous system. I always describe the nervous system as an oversensitive car alarm. Okay, so if somebody's car is broken into, that's your immediate tissue damage. Okay, car's broken into, that alarm starts going off. That's your nervous system telling you have pain. Your alarm starts going off to tell everybody that, hey, I was broken into. Right? All of a sudden, that car alarm becomes too sensitive to the point where somebody brushes up against the car and it starts setting off the alarms. Right? Same thing with your nervous system. It starts telling you have pain. All of a sudden a leaf blows by and your car alarm goes off. Right? So something that started off as very real and your nervous system was trying to protect you, all of a sudden becomes your nervous system being oversensitive and upregulated to the point where very small movements, things that should not be causing tissue damage, you're feeling very real pain. Right? One thing I want to emphasize is that when I say that your nervous system is sending pain signals, your pain is very real. Right? Everything you're feeling is because of your nervous system telling you to experience pain. It doesn't necessarily mean that it should be that way, and that's why we do things like cognitive functional therapy, is because we're trying to down-regulate the nervous system. We're trying to turn the volume down on that car alarm. Okay? So some things that we look out for would be maladaptive behaviors. These are things that are learned. often through experience, and then people just start doing them for a long period of time. Something like not bending. But a big one that I see would be holding your breath. Every time somebody hurts their low back, immediately we all start to hold our breath. I'm not really sure why. I do it too when I experience low back pain, and the most important thing you gotta do is recognize that you do it and try to breathe, right? Anytime you hold your breath, you're actually turning up the volume on your nervous system. You're upregulating your nervous system. So things like yoga and Tai Chi are very, they talk about breathing so much, and this is why. Is because, something called diaphragmatic breathing, which is really using your whole diaphragm to breathe, actually stimulates the vagus nerve, which is the one that basically turns everything down in your body, okay? So by doing these proper breathing techniques, we want to turn everything down. We want your abdominal muscles actually to be a little bit relaxed so that we're not clenching, because that's going to put stress on the low back. Yeah.
So I had shared before that I had the spinal cord injury and I was in a clamshell brace, and because of that and because of my pain, I was doing this real shallow breathing
Right.
for a long time,
Right.
where I got used to it, where I wasn't doing the deep breathing.
Yeah.
So I had to force myself
Oh, yeah.
to think about doing some deep breathing to restore that.
Yeah.
I mean, I just wanted to share it as an example.
That's great. No, I love it because it's a learned experience, and that's very hard to break.
But I mean, I literally had to do that
Yeah.
because I was at risk for paralysis, and my neurosurgeon said if you fall again, even while you're in your clamshell brace, you're still at risk for paralysis.
Mhm.
So.
Right. And those habits and maladaptive behaviors are eventually hard to change. But that's why you go to a professional is if you struggle with it, that's who you go see, right? Unequal weight distribution, I think I've spoken about this in the past at other events where, pretty much all of us use one side of our bodies more than the other, right? It's very natural. And in chronic pain or people with low back pain for a long time, we all start to shift our body weight a little bit more away from the painful side. And then that 55-45 split in terms of how much body weight I'm putting on my left versus my right, all of a sudden starts to shift towards 60-40, 65-35. Now all of a sudden you've got one side of your body that's just naturally weak because you don't use it as much, as opposed to what you would want, which would be relatively, equal muscle distribution, right? And then this is a really controversial one. Perfect posture. So some of the people with the best posture I've ever seen are my chronic low back patients. They have perfect posture. And the reason being, they were told the reason they have low back pain is because they have bad posture. So now all of a sudden everybody sits like this, very upright. Okay, they don't bend their back, they don't slouch at all, right? We talked again earlier about people that stop using their low back. They stop bending their low back. Most people, when they slouch, really should not feel much of a stretch in their lower back. But when I ask more of my chronic low back patients to actually slouch and bend their back, they feel this huge, immense stretch in their lower back. And the reason being, they're basically locking their muscles in one position and not allowing them to move ever, because they think that's the position that they need to be in all the time. But if I lock my muscles and my arms into this position for a very, very, very long time, and then never actually moved out of that position, my arms would feel super tight. So when I ask somebody with perfect posture to actually slouch and they feel that really big stretch sensation, they think, oh my gosh, I shouldn't be doing this. I feel that huge stretch. It's because they don't move their low back. So allowing yourself to bend and stretch that lower back is very important. Right? Some things that we look out for would be fear related to low back pain. So when you talk about a back sprain versus an ankle sprain, again, the low back is just another joint in your body for the most part. Nobody freaks out when they sprain their ankle. Generally that's going to go away in a few weeks. But there's this big stigma about low back pain of like, oh gosh, my back went out. Right? We hear that a lot. So it's always putting it into context. So I'm not going to get into the bull riding versus MBA. That's motor vehicle accident, by the way. Hypervigilance. So we see people with chronic low back pain just, they know exactly how they felt every single day in terms of their low back. And that's a really maladaptive behavior, is just constantly thinking and ruminating on your low back pain is certainly not going to make you feel better, right? Self-efficacy is basically the confidence that a person has to achieve desired outcomes. So that's something that we screen for when somebody comes in the door, is basically, do you think this is going to get better? And we see a lot of people that have chronic low back pain that really don't think they are. And that low self-efficacy is very closely correlated to whether somebody actually is going to get better. So that's why reassurance is so important. Telling somebody that they can get better is very important, because if they don't believe it, you're really going to have a hard time getting somebody to actually do it, right? And self-reflection. You know, I was answering a question before the presentation started today. It's like, what do you actually do? I just talk with you for the most part. I mean, I can do all the special tests in the world, but if I'm not listening to the person directly in front of me telling me what their problem is, I'm not going to get it. So spending a lot of time talking with that person's pain journey and how they got to where they are now is very important. And a lot of times it's helpful for the patient in front of me to be able to connect the dots and say, oh, I didn't sleep really well that weekend. My back pain was really bad that weekend. Or, you know, somebody very close to me passed away, and you know, my whole body didn't feel good. And getting people to realize that is very important. All right, so these are some very helpful messages that I like to leave people with. Again, back pain doesn't mean it's necessarily damaged. It's that your nervous system is telling you that it's sensitive right now, and you know, we can't always go to the idea that your back is broken. Okay, it's actually one of the strongest structures in your body, as opposed to what a lot of people think. And then relaxed movements are very key, right? Getting people to breathe through some of their movements. You know, somebody can do a perfect exercise for me, but if they're not breathing and they're holding their body very tensely, that's certainly not going to be a very good exercise for them then, right? Motion is lotion. Everybody loves a good run. But basically getting your body in motion and getting some blood flow is very important to help any issue, okay? Your scan changes are normal. We like to call it gray hair, right? You wouldn't freak out. I mean, maybe you would, but you wouldn't necessarily freak out if you started seeing gray hairs, right? It's just a natural occurrence that happens with aging. Wrinkles, right? There's things that show up on your MRI report that are very normal with aging. It's just things happen, and you can't just look at that MRI report and say, well, I've got disc degeneration. That's why my back hurts. It's normal, okay? The pain that you feel does not directly correlate to tissue damage. Again, people hurt their backs all the time. That's a low back strain or a low back sprain, right? But you know, pain one day does not necessarily mean that your injury is worse today. It just means that your body is telling you that it's more painful today, okay? And movements aren't always fun, okay? So some of the stretches you do, some of the movements that you do in the beginning are not going to feel great, right? It's like the first time you step on an ankle sprain, and after you let it heal for a little bit, it's not going to feel good. But actually we notice that with a lot of repetitions, these movements start to feel a little bit better. So, you know, don't let a little bit of discomfort with movement discourage you. A lot of people will tell me, you know, the first mile that I walked today was really not a good one, but miles 2 and 3 were really good. So keep yourself moving, keep yourself active. All right. How to keep a healthy spine, right? So we talked again about risk factors: depression, stress, sleep, smoking, obesity, hypertension. Fear avoidance would be, again, I'm not going to use my low back anymore because that one time it really bothered me. So avoiding things like fear avoidance. And then a sedentary occupation is a tough one these days. So the best way to offset a lot of these things would be staying active and staying moving. Right? The musculoskeletal system is the most reliable indicator of health. And the big one that we like to use is walking speed. I think I've shared this before, but increased gait velocity was associated with a higher survival rate in 35,000 older adults. So the key to survival is just walking really fast where you have to go, right? But really it's the fact that you can look at gait speed and use that to correlate how healthy an individual is. So maybe you can't walk fast because respiratory issues or cardiovascular issues limit you, or general achiness limits you, then that's going to correlate to some other issues. Okay, so predicted years of remaining life increase as gait speed increase. So it's a very good thing to look at in terms of general health. Okay. There were some nice studies that were done about the power of exercise. So people that report about 150 minutes of physical activity, and physical activity is even including vacuuming, walking, just outside for leisure, reduces the rate of heart attack, stroke, cardiovascular disease, and all-cause mortality. And another connection between exercise and premature death and heart disease is at the bottom there. All right. So the risk of dementia, heart disease, depression, all-cause mortality are reduced by 30% in those individuals that exercise 150 minutes per week. Colon cancer reduces by 45%, and type 2 diabetes, stroke, and high blood pressure reduces as well. So people ask me, well, what can I do? All right, it's exercise. All right, well, what's the best form of exercise for me? It's the one that gets you moving. It's the one that you enjoy. Okay. I heard that yoga is a great exercise for me. I heard that going to the gym is a great exercise for me, or Pilates. Kayaking? Yeah. If you don't like kayaking, though, I'm not going to throw you in a boat, right? So if somebody wants to get moving, how do I do it? Find what you enjoy and then go and do it. So if you love to walk, but you don't like to run, I'm not going to ask you to run. Walk, because it gets you moving very, very, very regularly, right? I'm not going to teach algebra to a fish, right? So I'm not going to take somebody that doesn't want to be in a gym and throw them in a gym and expect them to go 5 times a week. That's not a fair expectation for that person. But if that person loves pickleball, and that's what gets them moving, and that's going to be what gets them to exercise 4 days or 5 days a week, that's your best exercise for you. It's not a one-size-fits-all. So I like to identify what exercise is right for that person so that they can do it regularly.
What about raking leaves? I mean, like.
Gets your heart rate up.
Well, I know, I understand that part.
Mm-hmm.
But if you have, for instance, like a herniated disc or a bulging disc, is that going to aggravate it worse? Or like with the reaching and the stretching, you're going back, and I'm just curious.
If it's been a year and you haven't raked leaves, and you go outside and rake leaves for 3 hours, then, well, yeah, it might bother you. So that would be one of those things where if you've been working up to that activity for a long time, then yes, your body should be ready for it. But if you spent the entire 3 seasons before that not moving, then it'll probably irritate you. And that's where we have to keep your body moving, so that when you have to do something like that, or like shoveling snow, your body's ready for it. I see so many people in the winter come in with low back pain because they were shoveling snow. It's because they weren't doing it for 3 seasons and then decided that they had to go outside and shovel very heavy, wet snow. If that person was lifting and stressing their back in a regular manner for the rest of the year, then they're probably not coming to see me for low back pain, right? And that's the issue is, we all have things we have to do, but if you're just not prepared to do it, then anything could really be an issue at some point, right? That's why I said, somebody that doesn't usually bend over, all of a sudden bends over to pick up a very light pencil. It's not the pencil's fault that you hurt your back. It's the fact that you just haven't been doing it in a long time that's the issue, right? So some takeaway messages. Back pain is so common and normal that 80% of people in the U.S. are going to experience it at some point. Scans are rarely needed. The big reason a scan is needed, whether an X-ray or MRI, is because somebody is getting radicular symptoms. Radicular meaning shooting down the leg. We're noticing a loss in strength, right? If a nerve is impacted for a long time, you're going to notice that strength starts to be impacted as well. You start to lose reflexes. Okay, that's something we'll look for too. That's where a scan is necessary. It's basically to determine whether you need more advanced care. Okay, but just getting an MRI to figure out why you're experiencing acute low back pain is really not necessary. and a lot of times it's going to do more harm than good, right? They should really come with a health warning, because you cannot unsee the MRI results that you may find are, things are normal in an MRI result, but you can't unsee it, okay? Back pain is not necessarily caused by something coming out of place, right? So when we use the term, I threw my back out, or my back is out of alignment, a lot of times it's, more so muscular related. So somebody that's standing like this a lot of times is doing it because it's more of a position of comfort as opposed to something anatomically wrong, right? There are anatomical scoliosis, but a lot of times, when you go and get assessed and it says, your spine's out of alignment, a lot of times it's just it's a position of comfort for your body, so that's the position you stay in, but it doesn't mean that you're out of alignment. More pain does not necessarily equal more tissue damage. The perfect posture may not exist. Again, the perfect posture is the one that gets you moving and gets you active. So, somebody that sits in a chair for 8 hours straight without bending their back by sitting up nice and tall, that's not a perfect posture. You got to get moving a little bit and get in and out of that posture. Bending and lifting are very safe as long as you're doing it, gradually and progressively. Poor sleep, stress, all those things affect low back pain. Mood, worrying influences low back pain. Exercise is very good and safe, and persistent pain can get better. Right? It's certainly a complex concept, and something that you should see a skilled healthcare practitioner for.
We have a question from someone in Zoom. So recently I had a bad episode of low back pain. PT advised that swimming was probably not a good option at that time. Based on what you were saying about keep moving, would you have a recommendation on how to start out again? Keep in mind I haven't been in a pool in years, but I do love it.
Yeah, I'd be interested to hear what the specific case was that swimming was not recommended for it. Because I believe that there's always modifications that can be made. So again, I'd love to hear the story, because I'd recommend somebody stay moving. Even like water walking people.
Yeah, I was just gonna say.
Oh yeah, I mean, people at the Y are constantly water walking, and we do aquatic therapy as well. So there's certainly things that could be done in a pool, as opposed to just telling somebody, no, don't do that. I mean, the only time I'll tell somebody, no, don't do that, is if they came out of surgery and decide that they want to run. That's the time I'll tell somebody, do not do that. But if it's going to get you moving, I would recommend you keep doing it. If you're years out from swimming, then that's something where maybe you need somebody to walk you through the first couple times you're in the pool, just to make sure you're doing what's appropriate and what's healthy for you. But please get back in the pool. Just maybe at this point do it with some supervision first. Somebody that's trained to be able to exercise you in the water. Let Mark know, please, if that didn't answer your question, or if you want to go further on that question. Love to be able to help. This last one is a little bit tongue-in-cheek, in jest. So never underestimate the ability of the healthcare system to make you worse. Okay, so again, a lot of things are going to be recommended to you that may not be in your best interest, or there seems to be this system that you go in and you're recommended everything in a segment, right? Medication, your x-ray, MRI. And they're just kind of checking off a list of what they're supposed to send you through. And if none of all this works, then we're going to recommend a surgery for you, right? So a lot of times it's not in your best interest. So that's where I recommend multiple opinions. Because at times you may just catch a physician on the wrong day, or you may catch a physical therapist on the wrong day. So if it doesn't work for you for the first time, then certainly seek some more help. Okay? If anybody has any questions, my email address is on the bottom there. Again, I do treat out of the Phoenixville YMCA and the Collegeville location. The Phoenixville YMCA does have aquatic physical therapy, 2 large Olympic-sized pools. We have access to the entire gym, so a lot of times, people want to get to more of an independent workout routine, the Y is a great way to be able to say, your local gym has these exact equipments. If you want to, I can get you started on some of these things so that you feel more comfortable with it. It's something we do all the time. We offer free physical screenings and assessments, so if somebody is experiencing low back or shoulder or hip pain, we offer for somebody to come in and have that conversation with us. We'll really quick screen and tell you what we think. If we feel it's an issue that you can address on your own, or you should go see a physician for, or just a quick bout of physical therapy, we do offer that as an option. We take all major health insurances, Medicare and secondary insurances, so you can always reach out if you have more specific questions for me at that email address. Any questions from you all here or anybody on Zoom? Yeah.
I was just wondering if it makes a difference, like better or worse, if you're going to bend over, for instance, speed, like if you just suddenly bend over versus go at slowly or gradually, is like one going to hurt you or help you more than the other?
In my experience, the more your brain gets involved in movement, the worse it is. So the more you think about how fast should I be bending over right now, you're already kind of in a bad position, right? So that's where relaxation is really important. Taking that deep breath out and just moving at a, quote unquote normal pace is really important. You just got to let your body move the way it wants to. There's a reason it wants to move that way. So breathe through some of those movements in the beginning, and your body, I think, will do what's the right speed for you. Right?
I mean, I've seen people who bend over very quickly to get something, and then, ooh,
Yeah.
So maybe like they did it too fast. That's
Sure.
what I was just wondering.
I would say that a higher speed, you're certainly going to put your muscle at a different workload than you would if you did a medium speed or a slow speed. Actually, a slow speed is very difficult for your muscle to perform as well, for a very different reason. So a fast speed is actually going to basically stretch that muscle really quickly. A slow speed is going to ask that muscle to contract harder and harder and harder and harder the slower you go. That's the hardest type of contraction you can ask your muscle to do. It's called eccentric loading. You're using the muscle while it's lengthening very, very slowly. It's challenging. Similarly, so is bending forward very fast. That's hard too. So that's why I always say a comfortable speed, and making sure that you're relaxed is really the key to that. Does that make sense?
Question from chat, do you recommend use of a foam roller?
I do, especially in people that work all day. I usually have people put it right across their mid-back, and I'll have them extend back over that. If you're talking about using a foam roller just to roll out your muscles, it feels really good in the short term. It helps with reflexive relaxation of that muscle. That's why it feels good in the moment. It's not going to strengthen or stretch anything. So it feels good, but it's not the end all be all. And please let me know if that answers your question.
You had a question?
Yeah.
Yes. 2 weeks ago, exactly today, I washed and waxed my Corolla. And, elbow grease, no machines. I did, lots of shoulder movements and hard scrubbing. So 2 days later, I ended up with lower left back pain. I always had a history of lower right.
Huh?
Now, my question is, I've been noticing over 2 weeks that there's an associated, seems to be upper left behind my scapula, in that region of my back soreness also. Could the shoulders and stressing them out in all that muscular activity be the cause of pulling the lower back into a painful condition? Can that tense up first, or is it the other way around? Do you think?
It's complicated. It could be one causing one. It could be both just occur at the same time. But I won't usually tell somebody that their shoulder pain or their upper back pain is directly caused by their low back pain. It's probably that you were doing something stressful to the entire spine in one, activity, and you're just feeling the effects of that. I mean, are you saying that your scapular pain occurred after your low back pain, or it seemed to occur at the same time?
It seemed to be something I noticed as time went on after the lower back pain, that I noticed that there was this upper soreness higher up in my back, behind my scapula and in my thorax.
I mean, I generally tell people I'm not in the business of telling people why they hurt, but more so what you can do about it. But like I said earlier, is that a lot of people that experience back pain of some sort or any pain of any sort will start to change the way that they move
Yeah.
and the way that they hold themselves. So yeah, if you're experiencing left-sided low back pain, you may be compensating with the upper part of your back. And that's the challenging part of being in pain for even a little bit of time, is your body is going to compensate because it just wants to get through your day, right? So sometimes that can occur because you experience some kind of pain, or sometimes you just, you know, had one injury occur and then you had a separate injury occur. So it's a difficult question to answer, but it can happen. Yeah. Does that answer your question?
Yeah.
Okay.
Thank you.
Right, yeah.
Yeah, so, just, I'm curious, you didn't mention anything about food. I mean, like, are there certain foods that can cause
Sure.
more damage, or like, okay, like more processed foods, higher fats, like,
Yeah.
that would cause
Yeah, ketchup is
inflammation,
no
more
no.
pain?
Don't eat ketchup. That's a no no.
Don't-
No, I'm just kidding. I'm just kidding. Although my colleague did tell me that there's more ketchup in 3 tablespoons, or more sugar in 3 tablespoons of ketchup than there is in a glazed donut, which was shocking.
What?
Yeah,
I believe it.
yeah,
Yeah.
there's a lot of sugar in that stuff. But no, sugars are usually inflammatory.
Yeah.
Like high carbohydrates, not simple carbohydrates, but complex.
So
excuse me,
eat
complex
green,
carbo-
clean fruits
Yeah.
and vegetables.
Yeah,
and-
yeah. So things that are high in processed sugars are going to be inflammatory. Okay, doesn't mean you can't have it, but everything in moderation. Right? You have a question?
Yeah, the back pain is related to the joint, not to that I have disc.
Uh-huh.
Is that,
Yeah, it can. So there's a number of reasons that people experience back pain. Okay, you've got a lot of stuff going on there. You've got the actual vertebrae. You've got the discs in between the vertebrae. You've got a bunch of nerves coming out from the back. You've got muscles that cross those joints. You've got the actual SI joint, which is your sacroiliac joint. That's where your pelvis attaches to your low back. It's very complicated, right? There's just a lot of stuff going on. So that's where it can be important to get somebody to identify where some of your issues are coming from. It's very important to rule out nerve-related pain, because nerve-related pain is, we take that a lot more seriously than like a muscular strain. And like I said, there's a lot of reasons somebody could have nerve-related pain. It could be a disc pressing on the nerve. It could be inflammation causing that nerve to get disrupted. It could be muscle tightness. So it's important to get it identified. But there's a number of reasons somebody could experience low back pain.
yeah, I just have an accident now, 5 months and a half, and I discovered that I have 2 discs and also disc at my neck, and I go for cortisone injection and PT.
Yeah.
I get better a little bit, and after a while, it starts to hit me again, especially my lower back,
Right. Right.
and it's very painful.
Yeah, a cortisone injection is very helpful to get you moving, right? So generally people will have maybe 3 months of pain relief with a cortisone injection. And the idea is that in those 3 months that you didn't have pain because of the injection, you were moving. It sounds like you tried that, and now you're starting to get to that point where your pain's starting to come back, right?
Yeah, and I feel it after I try to have a normal life, I love walking.
Yeah.
So I walk and I sit more than 2 hours in a car,
Yeah.
and after that it's
Yeah.
as if it's the starting point, as if the accident just happened.
Right.
So it's very painful.
Yeah, and I'm not gonna be the one to stand here and say that like physical therapy fixes everything. But, you know, you can go down the street and get physical therapy at one place and it's gonna look one way. And then you can go down the street to another PT place and it's gonna look completely different, right? So that's where I recommend, again, if that's the experience that you're having after about 5 months, then it's not the worst thing to get a second opinion and see what maybe what you know is being missed. And that would be my recommendation.
Yeah,
Right.
thank you.
You're welcome. You're welcome. But keep walking, because that's probably not the thing that's causing your neck pain and everything.
Yeah,
Right.
I love walking.
Yeah. Perfect.
But if you have disc, it will be for life.
Correct.
How you deal with that for the rest of your life? How do you?
So discs, for the most part, you know, if you have a herniated disc, will unherniate. It takes a year or two, but it will go away. And staying moving the way you've been doing is really the key. You know, there are more complex cases where it does take a long time for your symptoms to go away, but the important thing is that, you know, you try not to develop those maladaptive behaviors, you try to not stop moving, because those are the things that keep you active and keep you healthy are the moving things, right? So that's where I recommend, again, you may not feel 0 out of 10 pain all the time, but reducing the symptoms in the moment is very important because everybody likes to be comfortable. So, you know, that would be my recommendation is
Yeah.
finding more
And
solutions.
also pain can cause a high blood pressure.
Correct?
Yeah.
That's right.
Because the last 3 weeks, I start have that painful pain. I discovered that I never had
Yeah.
high blood pressure.
Yeah.
But it's,
Yeah.
I need water, but it's.
Right. And the unfortunate thing is you go to your doctor, they tell you have high blood pressure, they give you blood pressure medication, which has its own side effects, which complicates an already complicated issue. Right?
She didn't recommend family
Well,
doctor.
that's
She
right.
didn't recommend it.
That's
Tell
good.
me, let's
Yeah.
solve the problem of,
Yeah.
so we'll see if it's still, so it's a high blood pressure.
Right.
You can take medication, but right now, no, I didn't take any.
Right, right.
Thank
So
you.
yeah, being in chronic pain does have, you know, other issues as well, with blood pressure being one of them. People with chronic pain naturally have a little bit more inflammatory hormones going on too, right? So that's going to cause other issues as well. So that's why it's always important, if you are feeling something, to get it addressed quickly, because you don't want that to become more of a chronic issue.
Yeah, sure.
Right.
Thank you, appreciate it.
Any other questions, Mark? Yes, sir.
What's the real difference between just a bulging disc and a herniated disc?
So disc herniation is probably more of a severe form of a disc bulge. So a disc bulge would probably just be like a little bit of the disc, you know, punching out of where it's supposed to be, as opposed to a herniation is where you have like a large part of the disc protruding out and putting pressure on a nerve. So a lot of times a disc bulge can become a disc herniation.
And in cases of herniation, is that usually always a high percentage of associated radiating nerve pain then?
Yeah,
Or
it can
not?
be.
It can be?
But again, people have disc herniations without having any symptoms.
No, depends on where it's herniating, if it's
Correct.
near a region of a nerve to
Correct.
affect and cause pain.
Yeah. Yep.
Is that something that can go away on its own, or does it require
Generally.
surgery?
Yeah, generally. In the more chronic cases where it doesn't go away on its own, again, that's where you and your medical team will decide, hey, maybe a surgery is in the best interest for you. But usually surgery should be a last option,
Yeah.
right? If you didn't try PT and you didn't try alternative solutions and the first recommendation was surgery, there better be a really good reason that was the first recommendation, right? So yes, a disc herniation can and will go away on its own, and if it doesn't, you know, that's when surgery can be considered. A fusion would be like under the most severe cases, right? There's always other surgical measures that you can take.
Now, I've talked with some people that have had injections, and they, like, I don't know if they didn't hit the right spot, but they didn't get any relief from it at all.
Yep.
So,
Yep. That's the case with a lot of those. So some people feel
they
relief.
still have to pay for it.
I know. Yeah, there's no guarantee on that. Some people will get an injection and feel good for 3 months. Some people will feel good for the rest of their lives. Some people will not feel good in any capacity. That's the chance you take. And unfortunately, there's a lot of side effects that come with injections as well, as that people are not aware. Starts to break down soft tissue. So frequent usage of corticosteroid injections actually starts to degrade soft tissue. So let's say, for example, somebody has knee osteoarthritis and they decide to get 5 injections. It's not helping your knee osteoarthritis, it's just getting you through the next 2 years so you can get your knee replacement
Right.
after that. Yeah. So that's the cautionary tale with injections.
Question from Zoom, if they made an appointment for a free consult, would they be seeing you or someone else?
you could special request me if you want. Or we have 2 very highly qualified doctors of physical therapy in Phoenixville and 2 highly qualified physical therapist doctors in Collegeville. So I do take free orthopedic screenings. My schedule is a little bit less flexible just because I'm in certain places at certain times, but you will be seen. And we usually schedule them within 24 hours, so you could be on my schedule tomorrow if you're lucky.
Okay.
Yes?
Inflammation is the body's response, is it to support and stabilize the injured area?
It's to bring nutrients.
And is it only for that, to bring nutrients?
Pretty much.
Inflammation? It's
Yep.
not to also stabilize and support?
Not really. I mean, it's not the reason that inflammation goes there. It's literally to bring your fighter cells, all the white blood cells that are there to basically clean and regrow. Inflammation brings all of those things to you, okay? What happens with inflammation is the more chronic it becomes, those white fighter cells actually die and become what we call zombie cells. And those zombie cells start to degrade and are not helpful for the joint. So that's where chronic inflammation is more of an issue. Inflammation, like I said, with a knee surgery is normal. That's there to help it heal. But if somebody has knee osteoarthritis and they have chronic inflammation, that's not a good thing. So that's a very significant difference. Is you want inflammation, but not for too long. Does that make sense?
Yeah, I had at one time a knee swell up, and
Yeah.
I talked to other people who had that thing, and they said, "Oh, I went to the doctor and had the fluids drained."
Right.
And I think that's probably the worst thing to
zombie
do.
cells. That's the zombie cells. You want those out of there. That's not good inflammation anymore.
Oh, how do you know when it's not good though? When the inflammation?
If it's chronic,
Okay.
yeah, more chronic in nature.
Okay. So if it's there a long time,
Yeah.
or if it's very return
Mhm.
frequently.
Yes.
Okay.
Yeah. A lot of times there's blood in that inflammation as well. A lot of times when they drain that knee, there will actually be blood in there too. That's an indication that that's not positive inflammation. Make sense?
Okay. Well, library's closing in a few minutes, so we need to call it a
Again,
night.
if
Thank
you
you,
have any more
Dr. Jeff.
questions, right there. All right?
All right.
Do you have a card here, or?
I should.
Okay.